you have to describe the background in which they develop. It's like before you really can examine, I don't know, a tree that is growing anywhere, you need to look at the ground where it is growing, because depending on which ground it was planted, it depends whether it will grow healthy or will be sickly or will be produce fruit and flowers or it will die young or it will be distorted and deformed and things of that kind. And this is pretty similar, The neurosis, again, don't happen just anywhere. It happens in human beings and happen on the ground that have been developed through your growth and your experiences and your genetic given and whatever combination of factors that created that will favor in a positive manner your personality, character, structure development and minimize the number of conflicts that you may be carrying with you, the amount of luggage that you carry. Or maybe things that already will contribute once you have to go to the developmental steps and stages that takes you from childhood into adulthood and the conflicts that creates and have to be resolved in order for you to be a normal human being and carry as little luggage as possible in terms of conflicts. All of that will be enormously influenced by on what background these experiences are going to take place. So I told you, you have a very good ego. You are much better endowed to deal with whatever these different developmental conflicts at different stages in development will bring to you and whatever vicissitudes life will present for you. You already have a background that is somewhat damaged by these early experiences. Then obviously you have shaky grounds to deal with all of it. In the past, when we knew little about these things, we just took it at the higher level and approached it just, from the neurotic development per se, without much looking at the background, always making the assumption that the genetic point of view is important and that this had a history which we could not precise. The more we know about neurobiological sciences, the more we know about the background and roots of all of the later manifestations in behavior, psychological phenomena, in feelings, in character structure, in personality, and so on. So in a way, we have many pieces. Imagine that you are a clockmaker and you have all the pieces there. What we are doing now, what we are going to try and do, is put them together so that you see how the pieces interact with one another and whether the clock is giving the time properly or is running behind or is running fast, And so the job that we will be trying to do here, and do it in a clinical, practical way, not in a theoretical way, but in a clinical, practical way. That's why I'm directing you to look at these lectures, because they are all clinical lectures, so that you can see how this really works in actual life and in actual human beings, And I think that's, for me at least, it's a lot more interesting. Now, like anything that grows, human beings have to go from really the moment of conception till the moment of death, and that's a progression. And how you achieve that progression is very complex. We are not going to look at what, factors of a biological nature may influence. We are going to take it from birth onwards and approach it now from the more psychological stand. What we were doing earlier is look at the neurobiological basis of it. Now we are going to take a little flight off in the stairs and go to the second floor and look down to the ground floor. Anything that grows has ideal conditions to grow to become the best specimen that it could be, given its genetic endowment. And anything that departs from these ideal conditions that it needs to be the best that it can be, to use the Army slogan, is a developmental interference for something that is growing and trying to go from birth to adulthood. So, what did you understand by developmental interference? Who wants to have a go at it?
I think it's a broad term that describes anything that interferes with the normal progression of development.
Yeah. Anything that interrupts the favorable flow of development is an interference with that development. Now, there are several types of them. Who can,
It's a normal process, and they're both internal and external interferences.
Yeah. It's not a normal process. It's an unavoidable process.
Yeah.
But, there are internal and external developmental interferences. External means what?
Environmental.
Yeah.
From the mother.
But it means things that people will actively do that somehow are not in the best interest of that developmental process and may handicap it, create a problem for it to proceed ideally and things of that kind. And that includes lack of stimulation, for example, inappropriate stimulation, whatever the reason. Whether it is a neglectful mother, a depressed mother, or psychotic mother, or drug addict parents, or God knows what, teenagers, mothers, and so on, which are really not capable of devoting the kind of attention and cathexis to the babies that they require. And so there are things that happen that shouldn't happen. That's external. And you saw many examples of it. There are many examples given there. And obviously, because development is a very complicated process and a long process and it's divided in stages, obviously there are interferences that are more typical for each stage of development. There are things that are more typical of the oral phase interfering with the development of the oral phase of the anal stage, of the follicular phase, of the latency period, of the adolescent period. Obviously, once you become an adult, ideally you have to stop essentially your development. It doesn't mean to say that you don't continue to develop in some form or another, but it means to say that the processes that lead to be an adult are now finished. And so these factors are not going to play a role any longer. Others will.
Dr. Nagera, is there a difference in the use of the term in that sense of maturation and development?
With external interferences?
Well, no, I'm just thinking of, you said when you've reached adulthood, you've essentially stopped developing, but you're still learning and growing in other ways.
Absolutely. You don't stop developing in a certain sense of the word, but you stop development in the sense that you have now become an adult, and all the processes that lead to adulthood should have been behind you. And if you haven't done that, you are in trouble. But that doesn't mean to say that adults get fossilized and don't continue to learn and progress. And indeed, you could divide adulthood into a number of processes that include getting married, having children, creating families, things of that kind. But that is not development in the sense we are talking here. we are talking of development in a different sense. Now, sometimes, as you read here, developmental interferences are not intended, the external ones. They are done out of ignorance or out of the psychopathology of the parent. They don't mean to do any harm or to interfere with the development of the child, but they don't know any better. And so when a child, for example, a situation is created in which unjustified demands are made of a young infant at any particular stage, which are inappropriate for that stage, that's a developmental interference. And you can think of anything. Let's keep with one example and follow it through so that we can see how these things change from one moment or the one stage of development to the next. If you think, for example, toilet training, and you have a baby that is 9 months old, and you have a parent that hates body pose of babies, have a problem with that and so on, would like that baby to be trained. And some people try to train babies. It's impossible. But they will try. Well, they will be making demands on the child and getting angry possibly and reacting, with inappropriate emotions to the fact that the child cannot comply with what they will want the child to do, which is to control his sphincter. Why is that inappropriate? Well, we are back where we were before in the earlier lecture. To be able to control your anal sphincter, it takes a large amount of time for the myelinization to go down your spine to the point, the centers where the nucleus that control the nerves that control the sphincter, the anal sphincter, can be reached. It takes a long time. Now, you try to do that before, you have a number of problems. First, the child has no idea what you're asking of him. He doesn't have the cognitive capacity to understand what you want to start with. Two, even if he had the capacity, which obviously he doesn't have the means to comply with your request.
Right.
And so if you behave in a demanding way, get angry, get inappropriate, want him to be clean, you are going to react in a way that is likely to provoke anxiety in that child, to make him restless, frightened. You raise your voice, dirty boy, or whatever it is, and none of that's an interference, It's a demand that is done inappropriately at the time that the child can comply with it. That's why I say here that many of these developmental interferences can be described as accidental as well. For example, the mother may have to be separated from that child at a time where the separation will be traumatic. If it is at 3 months, it probably doesn't matter a heck of a lot. If it is at 9 months, 10 months, after 12, 14 months, it will matter an enormous amount. It will be a traumatic event. But that may not be intended. The mother may be sick. The mother may have to go into a hospital and things of that kind. Sometimes people inadvertently, through ignorance, will leave the child, let's say, with the grandparents. Well, he knows the grandparents, so it doesn't matter. Well, it does matter a tremendous amount, and that's not a good thing to do. And in some form, it's a developmental interference. So, on the other hand, is what we were talking about. There is a lack of stimulation. That's a developmental interference. It doesn't get the hardware ready, the machinery ready to be able to, produce the kind of effects that will lead to learning, to growth, to control, to understanding, to making sense of the world, to putting things together, to get a better idea of who you are, what you are, and what the rest of the things around you are. Remember, we don't know any of this when we are born. We have to learn all of this. We have to learn, human beings have to learn everything. We have to learn to see. We have to learn to hear. We have to learn to speak. We have to learn to think. And some people never learn it. And so it goes, Now, obviously, the severity of the developmental interference depends on many factors, including how, abrupt is the interference, at what stage it takes place, what is the nature of the interference, and so on, And I give here a large number: parental holidays, marked and prolonged depression of the mother, exposure to hunger, to neglect or rigid feeding timetable, which are sometimes advised by pediatricians. They say, "Oh, you are spoiling your child." There were rigid timetables every 4 hours. Well, some babies drink very little milk, and they need to be fed every 2 hours. They're hungry a lot earlier. Some others, have a better feed. They feed stronger and longer and doesn't need food again. But they should determine. It's a need that should determine the need of the infant,
Especially when mothers breastfeed and they have no way of knowing how much milk the baby's
Absolutely.
taking in.
No.
It's very scary to see mothers' time do it.
Absolutely. Now there are sometimes the hospitalization of children, illnesses, and this is an internal type of developmental interferences. There are things that produce pain or distress of certain types that obviously will interfere with development, but they are not brought about by situations that happen in the external world. They are brought about by situations that happen in the internal world, and these are developmental interferences. So there are any number of them. Then there are, and that's important, that can happen at any stage of development. That can happen during the oral stage, the anal stage, the polygripal phase, latency, adolescence, up to the time that you become an adult. There can be interferences, with your development. And so there are any number of them. Then there are developmental conflicts, which are part of normal development. Developmental interferences are not part of normal development. They happen, and they are practically unavoidable. But they are not desirable, and if it were possible to avoid them, one should try to do that. Developmental conflict is different. Developmental conflict is something that is bound to happen. It's normal to happen in the normal course of the progression from here to there, growing from one phase to the next. Your different parts of your brain structure mature. And with that maturation of your brain structure, the psychological meaning of the world, and what your objects want from you, and what you have to do in order to be in the good books and so on, become clear. In other words, your cognitive abilities develop. You are acquiring knowledge, and you know now what the problem is. You take the example of the same example of toilet training. Well, at some point the conflict is this. Children, when they are born, they have no problem with the body products. They like them. They like it so well that they smear them, and they only, in fact, a child likes somebody. It's very likely that if you have it in your arms, it's going to piss on you or defecate on you. It's a gift. They don't do that on a stranger, generally speaking. Obviously, at some point, we convey to them that no, we don't like that. The bull faces make funny noises, and in any number of ways convey that is absolutely not welcome at all. And now, the child has developed object consciousness. He's very attached to his mother, and the mother is valued by herself. And the child's sense of self-esteem, self-worth, trust, safety is in being in the good books of the mother, the parents, but particularly the mother. But at this early on, it's more the mother than anybody else. But we're talking of 2, 2.5, things like that. So he's very aware, as you could say, of his dependence on that object, and how important for his well-being is to see that that object is happy and contented with him. The object becomes upset with him. His self-esteem and his sense of safety and security and being loved and so on gets very quickly very rattled. Now he understands, which he couldn't do as a 9-month-old baby, that what they want is for him not to defecate wherever he feels like or piss wherever he feels like, but they want him to do it in a particular place, or to let them know that he needs to do that. All right? And because he needs to be in the parents' good books, particularly his mother's good books, and he knows that she doesn't like this. And he has seen that by not complying with that demand, she gets unhappy, and that makes him very unsettled and anxious and, uncomfortable. Now he has an understanding of what it is that she wants. Not only does he understand what the mother wants or the parents want, he has the means to control his sphincter. Because by now maturation has reached the right place in the spine, and he can at will open or close his sphincter. Well, that's a developmental conflict. You see, maturational forces have raised the levels in different areas of development that create a clash. Now he has to choose. Is he going to continue to gratify his impulses, or is he going to please his mother and be what is more important to him, to gratify his impulses, or to have the mother upset, or to have the mother happy with him and being loving and the rest of it and so on. And usually, you know what happens, most people get toilet trained, yeah? Reasonably quickly and reasonably well. Well, that's a good example of a developmental conflict. It simply means that maturational forces have progressed in such a way that a conflict is now created that it did not exist before, because either the child did not have the cognitive capacity or the means to comply, even if he had the cognitive capacity, because he had no control over his sphincter. Now he has all of this, and had on top of that developed an enormous attachment to the object. It's completely dependent on that object. So that's a developmental conflict, and essentially the child himself will pose this question to himself when he understands. And of course, it is reasonable for the parents, when all of the factors are in the right place, that is, the maturational forces have reached the right stage, to start to demand, no, you have to become toilet trained now. You are a big boy now, a big girl now, and it's time for you to be able to do this. If they have all of the necessary requirements to be able to do that at will, including the understanding of what is expected of him, not why it is expected of him. He couldn't possibly understand that at this point, you know. But it's on the basis that he better be he's happier when he's in the good book of the mother, and mother is happy than when mother is unhappy. So, you know, he solves the problem. That's a developmental conflict. There are any number of them. At all stages of development, there are these conflicts, you know. And it's just that the balance of forces changes, and certain things have to be faced, and a decision has to be made. Now, so because of the development of these forces, at different points in development. Conflicts are created that they don't exist before and have to be solved. So, toilet training, again, demanded at the appropriate time and in reasonable form, is a good example of number 2 and number 3. And I say in a reasonable form because in an unreasonable form, by threatening means or punitive means or severe punishment, if the child will have some failures, which they will while they are in the process of becoming dry and clean, that obviously will become a developmental interference and will make the resolution of that developmental conflict troublesome. Okay? Now, if a developmental conflict cannot be solved appropriately, and take the example of toilet training, it doesn't become dry and clean at an appropriate time. He's carrying that luggage to the next stage where most children are already dry and clean. And that has all kinds of consequences. And what has happened essentially is that what was a developmental conflict has now become a symptom. Because it has passed the phase in which the behavior was normal, because babies have to defecate when they feel like it. In fact, they have a gastrocolic reflex. You feed them, they defecate. Once the developmental conflict takes place, the maturation of forces are at the right place, and he has an understanding of it. Now he has to solve it. He solves it, he goes to the next stage with that problem left behind, and nothing move forward that is of a negative character. He has created a neurotic conflict.
What are the age limits these days? Because now they say the age limits. The average age for boys is 3 to be potty trained, for girls 2.5. And when does it begin to fall? Because you hear some kids aren't potty trained till 4. When does it fall outside?
Well, that is variable, but generally speaking, really, between 18 months and 3.5 years, it should be accomplished. There should be some leeway. I tell you why. Because the strength of the instinct is very variable from one child to another. And sometimes, so they have the understanding, the capacity, they do well. The demand, the instinctual demand is so strong in some children that the conflict may extend itself a little longer than it will in those children that are born without such an intense, a strong instinctual force behind it. So that makes for the difference,
So to be flexible with the ages, more the progression.
Yeah, I think reasonably so, but, quite frankly, I will personally think that much past 3.5 years of age is already extending it a little bit. Because really they have the ability to control the sphincter by about 14 months.
So you could look at what's going on between mom and child.
Yeah, and there are all kinds of other factors there. You see, all of these things have meaning to people, not only to the child, to the parents.
Sure.
And all of these things reactivate the parents' own conflicts about these same problems in different ways. And you may have parents that were treated very strictly, for example, in terms of toilet training, that are hell-bent that the child is going to piss wherever he wants as long as he wants.
Yeah.
That has nothing to do with the child. It has something to do with the attitude of the parent, you see. So.
And then it would be an over-gratification.
Yeah, absolutely. And that is a problem. You see, remember, either excessive frustration or excessive gratification will lead to a fixation point. And a fixation point is one of the roots of a neurotic conflict. Right? All right. these things are done inappropriately. For example, some parents may not be punitive, but may force the child to be sitting in the pod for hours at a time until he performs, which is quite inappropriate as well. It becomes a developmental interference, and what was a normal developmental conflict with another developmental interference is likely to be not resolved. It doesn't get resolved, it leaves behind a neurotic conflict. That is a conflict between an instinct and the demands of the ego, the superego, which are representative of the external world, And remember too that for the child, it's not easy to give up his, he values his body products very highly, so he doesn't understand very well why it is that you are so upset with any of this. In fact, he thinks it's wonderful.
It's also curious, there's a wide variation in children who are able to attain bowel control, where some seem to have much more of an intense fear about it than others. To some it's very meaningful and will...
But it depends how you go about it. For example, some people want to train small toddler in a big toilet. Well, that's not going to be a very good idea, because that's very frightening. If you, the size of the toilet, which is about that, for you is nothing. For a toddler, he can see himself going down there. And then with his limited understanding, what he sees is that you put something in there, whatever is in there, it disappears. He doesn't have the cognitive ability to go past understanding that you want him to control his sphincter and do this in a different manner that he was doing till now. But he doesn't understand why you want to do that, or why this machine is all about. And it's like a scary machine. It swallows things, it makes things disappear, As you know, there are children, particular children that have some handicaps, that get very frightened, for example, of
anything loud,
carpet, cleaners, because
anything that makes loud noise.
Partly because it makes noise, which a toilet does, but partly because it sucks things up, and they don't have the sense that you and I have, that the vacuum cleaner cannot suck him up.
Even the bathtub drain.
You bet. So you have to take into account. You put a toilet by the size. You put a toilet by the size of the toilet, and it comes up to here. That's frightening. Imagine that you will sit in a toilet when that you stand by the side of it. It's up here, and it will have a similar, diameter, the hole. You wouldn't want to sit there very comfortably, would you? Well, that's the situation of a toilet. We have to take all of these things into account, obviously. Okay, in any case, the best example is that what was originally maybe a developmental interference of the parents demanding something becomes a developmental conflict, and by now the child has developed concern for the feelings and wishes of the object, and he values as much or even more that his body products the object, and so the decision is easy to make. He restrains his pleasure of doing what he wants whenever he wants. That's what he does. So, as you see, what was a developmental interference became a developmental conflict at some point, and either got resolved appropriately or not, and it became a developmental conflict through maturational processes, And it becomes what I call an internal developmental conflict, because there are now two opposite tendencies inside the child himself. And that's the basis of a conflict, you understand? Conflicts are always two forces opposed to one another. Yeah? So he has a conflict, and he has to solve it, or it won't be solved. Now, you remember that I put a lot of emphasis in the fact that not all of it is due to the behavior of the external world towards the child, that a lot of it is similarly due to the strength of the instinct of the child, which will make the conflict more severe. And the children are come in all kinds of sizes, shapes, and forms in this regard. There are children that play with the physics forever, it seems. Smear everything. They have a very strong tendency to do this. Other children don't do it ever. Clearly, it's like anything else. I always say, well, if I have a pen and an ordinary pen that I don't particularly value, and you need one, and you say, could you lend it to me? I say, yeah, take it if you want to. And now I have a pen that is especially valuable to me because somebody gave it to me, or because I bought it, because I had some special inclination to like it or whatever, and you ask for it, I'd be more reluctant to give it to you. There'd be something in me that say, I lend it to you, but don't take it away, give it back to me. And this is the similar situation, very similar. Now, all developmental conflicts are usually specific to certain developmental stages and to certain types of problems, and they are of a transitory nature. They only last for a little time, they get resolved, and you move forward to the next stage. They more or less disappear when the phase has passed. While they are active, though, you may observe, like you do in neurotic conflicts, some symptom formation in the form of anxiety, shame, guilt, depression, whatnot, which means it's an active conflict. It's like a neurotic conflict, but it's of a transitory nature, all right? Some behavioral disorders, some face-specific fears, things like that are common at that particular stage. Now, how they get resolved is very interesting. Sometimes the thing gets repressed. If it is liable of being repressed, you can repress defecating, you have to defecate, so you obviously have to do that, and you have to do it by complying. What you do is you become clean, what we call he became clean. Doesn't mean that he doesn't defecate, it means that he does it in the appropriate place at the appropriate time, and it doesn't make a mess out of it, all right? And so, how is this done? Well, when he does that, he may take this into the personality in form of character trait. For example, he's now a very clean kind of boy that, is upset about dirt, and certainly body products will be distasteful and disgusting to him, and so on. And so he may take that into a character trait by becoming excessively clean, which, if it doesn't go past a certain point, is probably a desirable trait. Now, if it comes so that he has to wash every spot of dirt in the house or in his shirt or something, it has become a symptom, right? And that's not good. That means that what was a developmental conflict that had been solved, either by leaving it behind, solving it, giving up the gratification, or taking into the character, or creating an inhibition around that kind of behavior, whatever way you choose. Obviously, some ways are better than others, has remained behind and has become a part of an unresolved conflict that is now a neurotic conflict. Okay.
And then sublimation also. Later on you go on to talk about sublimation being another way.
Yeah, sublimation is certainly another way, though at this stage in terms of body products it's not easy to produce sublimation, but a little later they may do that.
It should be more of a reaction formation.
Yeah, it tends to be a reaction formation early on. But let's say when he is, let's say that he has created reaction formation against it, or has replaced the gratification that is implicit in this activity, which for some people is enormous. Well, maybe when he's 20 and goes to college, he's saying, I'm going to become an engineer, will plan all the sewage of Tampa, or, things of that kind, which keeps him close to the thing, but it's at the same time a sublimated activity. It's highly regarded. Everybody will be very grateful to him for doing this and so on. And yet, as you see, what I'm trying to say is that the solution may keep very close to the instinct, or very distant from the instinct. Some people, let's say that develop a reaction formation, a strong one, will not come anywhere close, anywhere, any place where there are such products. Somebody like this one may have found a way to still have some gratification and at the same time achieve enough of the sublimation not to be in conflict either with himself or with society or with anybody else. There are all kind of grades, and that makes for different characters and personalities with different characteristics. We are all different that way. We have any number of choices that we can use, and obviously this flexibility is depending on your ego resources, the strength of your instincts, which essentially means your genetic given and your developmental developmental and environmental experiences. Out of the combination of all these forces, there is a resultant, and there is produced. It can be in the direction of normality, and normality obviously is a wide range of different phenomena, or it can be in the direction of psychopathology, and again, psychopathology comes in a wide range of phenomena, from very severe to very benign, Okay. Now, neurotic conflicts are different. They are simple units. The way I describe them here, neurotic conflict have many meanings, obviously, and is used in many ways. I mean here, like the bricks that will build the neurosis. Usually a neurosis is built up of a number of neurotic conflicts that get organized in a particular form of neurosis. And they are typical, and it depends on the stage of libidinal development where the conflicts took place, where the problem couldn't be resolved. It depends on the ego resources of the patient, and as I was saying a moment ago, on the environmental experiences of the patient. So, generally speaking, what happens is this. We have a lot of component instincts. They are always pushing for gratification. And obviously, some of them are okay. I mean, if you are 2, there are certain component instincts that are there, and you gratify them, and nobody says anything about it. It's appropriate for the age. Once you are 8, that would be any more acceptable, okay? And so, at some point, as you develop, obviously, other aspects of the personality will oppose the gratification of such impulses because you are learning from the objects and introjecting these commands into yourself. And at some point you make them your own, By then, of course, you have developed a superego and you are at an older stage that we are speaking at this particular point. What I'm trying to tell you is that through development, and until you get to the phallic idipal phase, which is somewhere between 3 and 5 years of age, a lot of developmental conflicts have to be resolved. Some get resolved and they enrich the personality with the resolution. Some don't get resolved and leave behind a neurotic conflict. In other words, 2 opposed forces that lead to some symptom formation, whether it is anxiety, whether it is shame, whether it is guilt, whether it is not be able to control your sphincters, whether that is urinating in your pants or defecating in school when you are 6, it doesn't matter. But it's a neurotic conflict. Obviously, when you are 6, you are well past a stage, where that was just a neurotic conflict. Now it probably has been organized as part of your infantile neurosis in one form or another. So, since there are any number of these things through all the phases of development, including the polyclinical phase, you can have any number of these things. You can have them later on, and they still will influence whether you produce symptoms around them or not. But typically, what happens is that usually between 3 and 5, the ego development has reached a certain peak, which makes then now the child, and of course he has started to develop a superego structure. He has internalized the commands of the external world. They are now inside of him. In other words, he has a conscience, which directs much of his behavior and tells him what is a yes and what is a no. No, cannot do, and yes, you can do. Yeah, and at that stage, the ego strength is such that it can organize things in such a way that it's like, I always give the example of Congress. Think of Congress. This country has 50 states, and we elect representatives for each one of the states, and we sit them together in Congress, where they talk to one another, and out of that Congress come the laws that control this country. Some states are more vociferous than others and create more problems than others, and they make more demand than others, and so on. And the same is true of the neurotic conflicts. They get all. You see, what the ego does is it organizes them into a unit, and so it fights in one front because it has reorganized them rather than to have to fight in 20 different places. And now we have the cognitive ability to do that and the resources to do that, and so it creates a synthesis of all this conflict in the form of the infantile neurosis, which will have a special characteristics. Let's say that your main conflicts are from the anal phase. All right? Well, you may well develop an obsessional neurosis. Your infantile neurosis will have the characteristics of an obsessional-like child. The way likely at that point, rather than the obsessional symptoms, what you will see is the phobic aspects of the obsessional neurosis. And so it goes. If the thing is conflicts at the oral level, that will be highly represented in the infantile neurosis. It will shape the external form of the infantile neurosis, And obviously, a child that has problem at that level is a child that is immature, is clinging, is demanding, is depending, is in poor shape. If it is conflicts at the polyclinical level, you will see a lot of castration anxiety, which is typical for that stage, but it's a higher level of development than the oral one or the anal one. So what the ego does is get it into synthesize the phenomena, and it has only one enemy, the infantile neurosis, not 25 different neurotic conflicts to fight with that will undermine the ego. That's why it creates a neurosis, where it's like Congress. It puts them together in a place and says, you fight them on yourself, and I deal with you. I'm the federal government, You see what I mean? Yeah.
When you were talking about the different levels of arrest and conflict, and I thought that the anal and the phallic were pretty understandable, but you were saying that at the oral stage, what you see is a whiny, clingy, demanding behavior. How does that relate psychodynamically to an oral phase? What is it that I'm...
Because that's an oral child. It's dependent, it's clinging, it's helpless.
Okay.
It's easily hopeless, doesn't have any resources to deal with any problems, so that's why he's very demanding.
Okay.
and things of that kind. It's typical for the face.
I guess I was looking for something simplistic, like or more, like biting behavior or something like that.
But you see that
Yeah.
too. You see,
Okay.
if you have fixation on the oral phase, instead of the child being frightened of knives or scissors, for example, when he has his hair cut and being very upset and frightened that they will cut his ears, he will be frightened of anything that bites.
Okay.
He will be terrified of dogs.
Hounds.
Yeah.
Yeah.
Okay. Got it.
Okay. All right. Now, the infantile neurosis, or neurosis proper, is the first neurosis, and it's the prototype of all the other neuroses. All other neuroses are going to be based on this one. Now, obviously, as you grow into adolescence, some factors will be added to it, and then you have an adolescent neurosis when you are an adult. Other factors are added to it, other resources are added to it, and you may reorganize this neurosis in a different kind of form, and you have an adult neurosis, but the prototype of all neurosis is that first infantile neurosis, because that's a summary of your development up to that point, with all of your assets and positive things and the things that you build into your character structure and your personality and will enhance you, and all of the shortcomings and things that you were not able to solve that are producing anxiety, shame, guilt, and symptoms or inhibitions. They are there. The only thing is that the ego has now the capacity to organize all of this so that it fights only one front. All right? Which is highly valuable, yeah? So typically, any neurosis proper or any infantile neurosis, the first one of them, will include several neurotic conflicts. And that's very variable. Sometimes they come just from the oral phase, or only from the anal phase, or only from the phallic phase, for example. Obviously, the higher the level at which the conflict has taken place, the better the prognosis. Obviously, there are people that have conflict in all the phases of development, or in more than one of the phases of development, and obviously that is a more severe neurosis than the one that is only at one level, with one exception. Those that take place at the oral level are always much more difficult than any other. The prognosis is always much more severe. But obviously it's even more severe. If on top of that there are conflicts at the anal level and the phallic level, then it's a multi-expressive neurosis with symptoms coming from all areas of development. And that makes the treatment more difficult. The prognosis more reserved. It's not impossible to treat them at all, but you have a patient that probably will require longer time in treatment and more effort on your part. So, all neurosis proper includes many neurotic conflicts. Now you have to distinguish, and this is important, neurotic conflicts, which are the result of a clash between an instinct and an opposite force coming from the ego or the superego, which is, an identification with a demand from the external world, one of your parents or whatever it is, from the conflict between the child and the external world. That's different. A neurotic conflict is always already an internalized type of conflict. All right?
I thought your statement about social behavior, the caveat to look at the etiology, that if it were due to a neurotic conflict, it's more treatable than if it's due to a superego deficit.
Yeah, well, that's a difference. That's not a neurosis. See, that effect on the structure of the personality for whatever reason, and that is not a neurosis, and it can be treated like a neurosis, and it's much more difficult to resolve, because it's like the things we were talking earlier with critical periods. If you don't acquire superego at the right time, it'd be very difficult for me to put it inside of you when you are 30 years old. Not going to happen, very likely. You are going to continue to be whatever you are, a sociopath, a psychopath, a very disturbed personality. Is different. That's a defect in the structure of the personality. A neurotic conflict is a clash between two forces, one coming from the instinct or human needs, and the other coming from the ego and superego side, which in fact is a representative of the environment and the society in which you live. As you know, the conflicts are different in different societies. Some societies are very tolerant to certain things, others are not. So it depends where you are born, what you internalize. Yeah.
So all neuroses or neurotic conflicts are ego dystonic, right? Is that true?
Oh yeah, all neurotic conflicts are ego dystonic. If they were ego syntonic, you develop a perversion.
Okay. Yeah.
Because you will be gratifying a component instinct that is no longer appropriate at 30, like, I don't know, masturbating anally or whatever it may be, and that's a perversion.
Are they treatable?
Yeah, they are treatable. They are treatable. But they have, it's more difficult to treat. It's like, you see, it's a solution. There are different solutions. Some solutions go into the neurotic type of solution. Some solutions go into the character solution. Some solutions go into the perversion type of solution or the sociopathic type of solution. They are all different. Some are treatable, some are not. A perversion, if it is completely ego-syntonic, is not treatable.
Because I have a 13-year-old who is stealing his mother's and grandmother's underwear and masturbating in it. And he is not, he's, so to speak, doesn't appear to have conflict.
No, that's probably ego-syntonic, and that's treatable, because that behavior has meaning.
Okay.
You see, he's wearing the mother's pants or the grandmother's pants with some fantasy behind it. If you can get to it, you will understand why it is so important to him, and that may be very difficult to do. But once you understand that, it may be that you can undo what created the need to do it in that particular way. After all, there are other ways of doing that that are more gratifying than having to wear your mother's pants or your grandmother's pants. But so that's probably treatable, because that is not as much a perversion. It may be ego-syntonic. He may have no objection to it, but he's compelled to do it at a point that he hasn't quite finished his development. So there are some slight difference, but it could easily become a type of perverse activity. It could easily be.
So if he were masturbating on those, then it would be a perversion for sure.
If what?
If that became a sexual object, a sexual
well,
object.
if that's all it is, you see, if it's substitute for the genital activity, then it is a perversion, because that's what a perversion is. It's an earlier component instinct taking the place of the sexual organs. Of genital intercourse, of intercourse between a man and a woman. And so if he prefers to masturbate inside his mother underpants or her mother underpants to having a woman to enjoy his sexual life with, that's a perversion. Because he has taken the place of the genitals. You understand what I mean? But we don't know that that is the case now. He's only 13.
No, I was just hypothetically speaking.
And he has no access to any other form of gratification at this particular point in time. Later on, when he's older, and maybe access to more mature genital forms of sexual intercourse become available to him, he may leave that behind. He might not. certainly. It's not the most normal of developments, and it already points in the direction that there are some problems that boy has that are quite severe, obviously. Okay. So it says here that some developmental conflict cannot be solved, and when development proceeds further, they remain behind as unresolved conflictive areas and have created a neurotic conflict. In other words, what should have been a transitory developmental conflict now becomes a permanent neurotic conflict. They will remain active and integrate themselves into the infantile neurosis, the adolescent, or the adulthood neurosis. As conflicts of an internalized nature, you have to clarify the role that is played by the superego. Now the conflict is between the gratification or whatever it is that is looking for gratification, and it's not acceptable superego-wise. Now, sometimes, and what it says here, you have to you have to clarify the role of the superego, is that it may be that the superego is so severe that is subjecting to a gratification that is perfectly legitimate for most people. In which case, it's not a problem of the drive, it's a problem of the superego. And your effort has to go in the direction of understanding why he has a superego that has such a strong objection to behavior that is acceptable to more people. And that's where the beef is, that's where you go, It's different that when the problem is because the conflict is with the instinct itself, and it's an inappropriate instinct that is looking for gratification at a time where it is out of phase. It should not any longer be an important, form of gratification for this person. It should have been superseded by a more mature form of gratification. All right? But you see, I'm telling you this so that you see how development and the things that happen during development will give shape to the type of neurosis that you develop. We haven't yet gone into exactly the mechanism by which that happens, but it's the background that will explain much more clearly and make it a lot easier for you to understand what you are dealing with, what the nature of the conflict is, what the prognosis is, where you have to go, and what you have to deal with if you're going to improve this patient. It's not a matter of trying to put the tail of the donkey in the dark or blindfolded. That's not what an analyst does. An analyst has a plan. He understands how this got to be put together in this particular patient, and then he goes about trying to do that thing that happened in a way that is cautious, is progressive, is comprehensive, and will get to the right goal, It's not just like this fellow yesterday, I have a better plan. Well, tell me what it is. An analyst has a better plan. He knows what he's going to do. A good therapist has reasons to do what he's going to do, and they are basing his understanding how these things got put together developmentally and genetically, okay? And of course, he knows what the resources, strengths are of this patient, what the genetic givens were that he was blessed or unblessed with, what the environmental situation may have been that contributed to whatever it is that you are observing now. And out of that mismatch, he's like an anatomist. He's going to dissect things, make them clear, separated, and start to help the patient to see what happened, how did it happen, and how his reaction, which was appropriate at the time that it took place, is now inappropriate, that he has resources to deal with that differently, Okay. Now, the infantile neurosis, incidentally, is universal. Nobody escapes that. We all have an infantile neurosis. It may be more or less severe, it may be more or less abnormal. But we all have these conflicts. We all have to put them in some place. Some of us don't have too much problem. Some of us have a lot of problem and left behind a lot of difficulties. So there are differences among different people, but what there is no difference at all is that we all go through that process. More or less successful, but that's what it is. Okay. Now, there are obviously what are more normal, like infantile neurosis. You see them and you say, yeah, sure, he's going through the conflicts of the face, and you are seeing the manifestations of it in terms of symptoms, but it's within the limits of the normal. Some you already see that this is well past the limit of the normal, and you know he's not going to come out of that clean. He's going to come out with a residue that means an adult neurosis, all right? Now it says here, and I don't know, when you follow the thing in the webpage, I don't know, you know that you can print the slide.
I tried.
Yeah, you
I
can
had to
print.
cut and paste it into Word.
Did you?
Wouldn't print directly from it.
Yeah,
The computer that I was using seems like Deborah told me the other computer I'm able to do that because I wanted to get that graph that you had at the end.
Yeah.
That's what I really wanted.
Yeah, well, you can print all of that. The graph is in a, all of this is based on a book,
Monograph.
Okay.
which I wrote,
Yeah.
which is called, whatever this is called, Developmental Interferences, Developmental Conflicts, the Infantile Neurosis and the Adulthood Neurosis. And it's a monograph of the psychoanalytic study of the child. It's monograph number 2 of the psychoanalytic study of the child. It's a classic. It's all over the place. And you can read it in an evening. It may be 100 pages, maybe. And it's very readable, actually. It's very clear. And it gives you a very good feeling for how things get to put together, so that when you look at the patient, you are looking behind what you see at the present time into how did that get to be the way it is. You learn to think in a different manner, You learn to see it in a different manner. The book is still available. You can get it anywhere. The infantile neurosis, as one of the slides, is an attempt to organize all the previous and perhaps manifold neurotic conflicts and developmental shortcomings, with all the conflicts typical of the phallic-idipal phase, which has its own conflicts, into a single organization, into a single unit of the highest economic value, save ego resources. It makes the fight a lot better. It's like a general. I mean, if he had to fight 20 different fronts, he divided his forces into 20 pieces. If he consolidates all in one place, he has all his strength to fight whatever it is that he had to meet them, But once that has happened, that's the call for the latent neurosis, Now, and then you have the schema, which unfortunately I don't have here because I distributed it, I think at the time I did this, but it's in the book, and if you remind me, I may be able to bring it back and make a few copies of it. But in that scheme, you can see how things go from one place to another and come from different phases and lead to different outcomes, from a neurotic conflict to something completely different.
Right.
And it's a very useful way of looking at it. Now, this is completely different from what you will see in DSM-3. That's a descriptive. This is completely different. This is a metapsychological assessment of the development. Okay, why don't we leave it there, and I see you next, whenever it is. When is the next
2 weeks.
2 weeks.
2 weeks, yes.
Go to the webpage and look at the thing. As I said, in most cases, I think you can download the slides